Palliative care is a new subspecialty of medicine since 2006. You've kind of done your training in 10 different fields and do a palliative medicine fellowship and be boarded, and a palliative care specialist. So medicine and family medicine, OB-GYN, radiology, ER, everything, surgery, etc. And I'll just tell people we're starting our fellowship in this year, and here at UNM. So we are the only fellowship in this state. So back in the 60s, 50s, 60s, this woman in the UK, Cicely Saunders, said, people are dying in pain, not being, because we can't cure their illnesses. People sort of get abandoned by their doctors, and we need to have some sort of a service to help people to die better, more comfortably, and seen as people, not just as disease processes. So she started the modern hospice movement, which came to the U.S. in the early 70s. And that was great for people who wanted to be at home, had a life-limiting illness, etc. But the reality is most people end up dying in the hospital in the U.S. Balfour Mount, who was a surgeon, said that we need to take that philosophy of care for people and bring it into the hospital setting. And so in the 70s in Canada, at McGill, he started basically the first palliative care program. Palliative means to cloak, to comfort. And he said we need to take those concepts of hospice and put it in the hospital. Different than hospice, we are a consult service. We are not only limited to people who are actively dying, people at end of life, although we do see people who have life-limiting or threatening conditions, but we can coexist with treatments to fix those illnesses. And unlike hospice, which basically is people with a time of 6 months or less, if that illness runs its natural course, then the treatments are comfort-focused. We are upstream from that. Reasons we get consulted are to help clarify what are called goals of care. Here we are medically, here's what the patient and family are hoping for. How can we, mesh those things? We have Vanita, who's our program manager and educator on Native American issues. We have other docs, nurse practitioners, social worker, chaplain, arts and medicine, this big team to try to address all those issues. And the focus of palliative care is really what we call whole person care. People are spiritual, they're emotional, they're physical beings. They're not just disease processes. So that's why we need a whole team of people to address all those issues. We see adult patients. I think we have seen some teenagers who are on adult medical services, but our service is just for adult patients. And our patients we see reflect the ethnic diversity of the hospital. I think about 12% of our patients are Native American from all the Navajo Nation and Pueblo tribes. We see about 45% Hispanic, 40-some% Caucasians, etc., which is similar to the makeup in the hospital. We use the interpreters a lot. The attending physician has to approve it, so it has to be a physician-generated consult. Although sometimes we do get called from other members of a team saying, could you look into this? And then we'll call the attending and say, is this something that you want us involved with? We get consulted by all areas of the hospital. Every admitting service consults us. So ER, TSI, family medicine, whoever. And as a consult service, we have this team, and we go in and we try to address physical symptom issues. We address family support, goals of care. That's the most common reason we get consulted. So the team is saying, I think this isn't going well, but the family seems unrealistic, or, we've got this issue about, doing chemo or not. So our team often has a little more time to spend with the patient and family to kind of sift out what are the issues, what are they hoping for, what are their concerns, and so we collaborate very much with the team. We don't take over the care, we collaborate with. We bill as any other consult service for symptoms, for time, etc. So it's never an issue that an insurance doesn't cover what palliative care offers, because again, it's like any other consult service. And we're Monday through Friday, right now. So we take new consults right now, Monday through Thursday from 8 to 2 or so that we can finish by the end of the day.